Hey everybody, how you doing? I got Dr. Holly Richmond here with us. She is a somatic psychotherapist. She's an LMFT, licensed in California, Oregon, and New Jersey. And she's also a certified sex therapist. Dr. Holly will be presenting for us a 4CE live webinar entitled Helping Clients Recover Sexual and Relational Health After Sexual Trauma. That's happening on April 8th, 2022, starting at 10 a.m. Central, 11 a.m. Eastern, right here on onlinececredits.com. It's now open for registration on the live events page, so be sure and check that out and register if you haven't already. This upcoming CE webinar is actually based on Dr. Holly's brand new book, and it's entitled Reclaiming Pleasure, a sex-positive guide for moving past sexual trauma and living a passionate life. It is published by New Harbinger Publications, and it's now available on Amazon. So be sure to check that out. A very nice compliment to her workshop she's given for us. So Dr. Holly, thanks so much for joining us today. I'd like to give folks sort of a preview of what they can look forward to on your April 8th workshop coming up. So I have a couple questions for you, if you don't mind.
That sounds great, Tim. Thank you so much for having me.
Thanks for being with us. We're so excited to have you. And the first question I have for you is, can you explain how somatic sex therapy promotes healing from sexual trauma differently than, say, perhaps a general trauma treatment approach?
Sure. And that's really, what you just kind of highlighted there is the reason I do this work. So I did most of my 3,000 hours at a rape crisis center, and I learned quickly that I was taught very well how to treat trauma, but I didn't know how to treat the what comes next, being healthy sexuality and reclaiming solid relationships for people who have survived sexual trauma. So to me, it really made sense. Okay, if I'm going to study sexuality, I need to study the body. So in that way, the somatic psychology piece made sense. And then coupled with a sex therapy to really understand what does healthy sexuality mean and how can we translate that past this trauma model, because the trauma model is necessary. It's so important, but there has to be that what comes next piece.
Absolutely. And I know that piece of healing is often difficult for clients and some therapists to even approach and talk about. So that's fantastic. My second question for you is, can you touch on one or two common symptoms of sexual trauma that tend to respond well to the therapeutic approaches you're going to touch on your April 8th workshop?
Absolutely. And this is an area again that goes into that somatic psychology, because we see symptoms in really four quadrants. They are emotional, physical, relational, and sexual. And oftentimes survivors, our clients, aren't making the link between the symptom and the trauma. They're just feeling broken. They're feeling like I'm crazy. I keep going to a doctor because this is a symptom I have and they keep telling me nothing is wrong. So much of my work is connecting the symptom to the trauma. So some examples: feeling out of control, having a lack of boundaries, eating disorders, hypo or hypersexuality, and difficulty communicating sexual needs.
Yeah. Thank you so much for that piece.
Yeah.
The third question I had for you to kind of round us out: what are some positive changes that your clients have experienced after receiving the clinical treatment techniques that you're going to share with attendees?
Yes. So I'm going to share just one piece. So it's really a three-pronged approach. The second piece that I will give away is understanding pleasure. So within this pleasure center, I do something called sexual template work. So I really help my clients understand desire and arousal. So for me, the desire is the psychological process of wanting. Arousal is the physiological process of wanting. So really, with each person, understanding what turns them on, what do they find sexy, what helps them connect to themselves and to others in an erotic way. And when I use this word erotic, it's not necessarily sexual, it's about life force, energy, vitality, vivacity. So how do we combine this into this area of pleasure so people feel really grounded in the choices they make and who they are as authentic sexual beings?
Fantastic. Well, that's all super interesting. I know it's definitely whetted my appetite. That was an awesome preview. We're so much looking forward to having you on April 8th. I know I'll be there in attendance myself. So I just want to say thank you for your time today, and we look forward to seeing you on April 8th.
Thank you, Tim. I look forward to seeing you then too.